Welcome to Good Samaritan Health Services. My name is Heath Playcheck and I'm the administrator with Good Sam. On behalf of our board of directors, staff, volunteers, and countless church and medical partners in the community, I want to thank you and welcome you to our team.
Hi, I'm Michelle, the volunteer coordinator. We can't wait for you to get started and experience the joy of serving those in need at our mobile medical clinic. Even though each clinic is unique due to their facilities, the flow stations and the volunteer roles are the same. All of our stations require volunteers to discreetly observe patient confidentiality. This is very important, and we'll talk more about this later in the video. Each clinic has a nurse coordinator that is a staff member and is in charge of that clinic. Each clinic also has a volunteer site coordinator that manages the site and volunteers of that clinic. Your site coordinator will communicate with you about scheduling and clinic procedures. In addition to your training, you will have an experienced volunteer assist you in learning your new role at clinic. Follow me through the clinic stations. Greeters are our volunteers that make our patients feel welcome and kindly direct them to the check-in area. At the check-in, our volunteers check our patients in and give them the necessary forms to fill out to see the doctor. After check-in, patients come to the registration, where they get their information verified and entered in our electronic medical record system. After they get done with that, they will go back to the waiting area to go to the next station. Vitals is where the patients come to get their height, weight, blood pressure, and medical history taken. Our volunteer runners escort our patients to the medical truck. Prayer partners provide an important part of care that we provide for our patients. At our checkout station, the volunteer makes future appointments and takes patients' testimonies. Interpreters help serve our Spanish and Burmese-speaking patients as they move throughout the clinic and see the doctor. When your volunteer duties are complete, check with the site coordinator to determine if any more patients will be coming through your area. If not, clean up your area, put away supplies, and let your site coordinator know that you are finished. Always let your site coordinator know before leaving. And remember, all volunteers must discreetly observe patient confidentiality. I'm going to review some policies and procedures with you. Please refer to your volunteer manual for more information. Our dress code is casual. Jeans and t-shirts are acceptable. No shorts, flip-flops, or other open-toed shoes. Nurses, however, they are welcome to wear scrubs. Weapons are strictly prohibited at clinics. Please alert your site coordinator if you become aware of any weapons at clinic. All staff and volunteers of Good Samaritan are required to report any suspicion of abuse, neglect, or exploitation. You will receive more information during your training about whom to contact. Staff and volunteers are not to receive personal gifts from patients. Patients can donate to Good Samaritan by completing a donation envelope so we can send them a tax receipt. In healthcare, patient confidentiality is critical. What happens at clinic stays at clinic. We do adhere to federal HIPAA laws and regulations. Information about patients is not to be discussed with anyone except to those who manage the care of that patient. Do not discuss patients and their conditions outside the clinic or post about clinic on social media. Do not discuss a patient's conditions at the check-in area or the nurse's area unless it involves their care. Records, files, volunteer and patient data, as well as clinic activities are confidential. Because confidentiality is of utmost importance, we ask all of our volunteers to agree and sign our confidentiality agreement form prior to volunteering at clinic. At Good Samaritan, we provide a positive and professional environment for our volunteers, staff, and patients. We ask that you treat others the way you would like to be treated. Be on time for your assigned volunteer duties. Keep a good attitude at clinic. Treat all patients as though they are our guests. Maintain a professional relationship with patients during clinical contact. Safety is a priority at our Good Samaritan clinics. We ask that you follow the safety guidelines found in your volunteer manual. Report any incident, injury or non-injury, to the site coordinator and the nurse coordinator. Any blood or body fluids such as saliva, urine, etc. are considered potentially infectious. Therefore, you must protect yourself by wearing appropriate personal protective equipment when you suspect possible exposure to any body fluids. Here's our personal protective equipment. We have goggles, a mask, an apron, and gloves. Not all of our volunteers have to wear gloves, but they are available if you need them. And we would ask that you not throw potential infectious waste in the trash can, but use one of these red biohazard bags. Fire safety. The procedure for responding to a fire is to follow the acronym RACE, which stands for Rescue the Person, Sound the Alarm, Contain the Fire, Evacuate. How to use a fire extinguisher. The procedure for using a fire extinguisher effectively is to follow the acronym PASS, which stands for pull the pin, aim at the base of the fire, squeeze the trigger, sweep from side to side, front to rear. Weather alert. Each clinic has a safety plan. Your site coordinator will share that plan with you as part of your clinic orientation. Hazard communication. OSHA requires a safety data sheet, SDS, for any chemical determined to be hazardous. Good Samaritan has safety data sheets which are located in a 3-ring binder in the nurse's area on the truck. All the information that we covered today is also in your volunteer training manual. I look forward to continuing your training and getting you placed at clinic.